enhance the community engagement strategy, working with local community leadership at the village level to conduct door-to-door mobilization of potential blood donors. And again, during this time, the community resource persons, the Red Cross volunteers, the village health teams have been involved to reach out to potential blood donors, and in some areas we have had great success. This will be intensified moving forward to comb villages where donors are residing. Still on the strategies, a proactive communication strategy with donors, the public and stakeholders is ongoing to build their confidence in blood service about the COVID-19 blood service emergency response plan. And it is targeting the recall of regular blood donors through phone calls, messaging, and providing donor transportation to donor sites. We are also carrying out strengthening the e-recruitment platform through the e-Delifarm system, digital blood and blood for Uganda. Still on the strategies chair, there is provision of personal protective materials such as masks, soap for hand washing to the donors, which may be restricted to access donor sites, who may be restricted to access donor sites without PPEs. We continue to provide donor motivation and recognition items, the same items that you know that we give to the donors to encourage them to come. We continue to reorient our staff on infection threats and actions that need to be taken to ensure safety and reliability of the blood supply for the staff and the donors as well. We are leveraging on partnerships and stakeholders, and these include the media, associations, healthcare providers, corporate organizations, factories, and other places of work to support blood donor mobilization campaigns and win the subscribers to donate blood. We are also continuing with advocacy to government to come out strongly on bad practice that goes on in our health facilities that create artificial blood shortages, leading to alleged sale of blood. It is a demotivator to voluntary non-remunerated blood donors. I'll now move to the next slide, which is a proposition to operationalize the strategy. To effectively implement the mentioned strategies, UBTS requires additional funding. As I have been mentioning before, the costs have been high, moving direct to the villages to collect blood, mobilizing the blood donors, and transporting blood to the facilities during the lockdown. So UBTS requires additional funding to meet the increased costs of operations in terms of, one, address the critical issue of human resources in order to increase blood collection teams, procurement of UBTS purpose-built blood collection vehicles, additional fuel to move the donors that we have to pick from all over the country and deliver them to the blood donation sites. There is need for personal protective equipment for the staff that are engaged in bleeding the people, funds to roll out the proactive communication strategy that is meant to encourage people on emergency blood response during the pandemic. We also have an area where we have not made payment, the 2019 10 billion supplementary budget to NMS, where NMS was requested to make a call-off and the money was never sent, so the supplier has not been paid. And lastly, I have attached a costed work plan that I will request Dorothy to take us through from here, with your permission, Chair. Go through the work plan.
Thank you, Chair, and thank you, Honourable Minister. I think maybe we need first to look at the have attached that shows our collections. As we can all realize, we've been doing well since July. The problem started in April. And as you can see, we reduced on the collections because of the lockdown. But after there was the easing of the lockdown, we are beginning to pick up again, and we hope maybe this was done in May, the lifting of the lockdown. So we relatively collected more, but now I think the blood donors, they donate once in 3 months. So now we need to go to more areas. And when you look at the other graph, you can see the target for the is 25,000, but you can see since February 2020, the collections have really gone down because of the lockdown. And I think I shared in the presentation the conversation that when Honorable Rebecca Kadaga tweeted, I think you can see what the people replied. When you look at the last slide, there was people were complaining we are not feeding well these days, so we too lack blood. That was one. Another person said they will comply. Then another one said, let all the 480 MPs give back to community by donating blood, because it's the only thing they can offer to people. The last page. This is what people are treating. And somebody was asking, do they have safe blood? And then now the other person said the communities have been starving. I doubt there is any blood for them to donate. So that one said, include MPs on your list. They could be more resourceful, especially at times like this and COVID. So I think you can see the responses of people when the Honorable Kadaga tweeted people's feelings. Most of them are saying they have not received the food, they are not eating well, they have no money to come to donate blood. So it is a very, very big challenge for us. So
the vice chair of the National Task Force is here, so you are giving the information to the right person.
Okay, so we come up with a cost study strategy, looking at the critical areas to mitigate blood shortages in the country. So number one, we looked at the call center, and the purpose was for calling up repeat donors for donation. So there is a budget. We want to set up a call center in each regional blood bank and each blood collection and distribution center. So the budget is 234,800,000. So we shall buy computers, send bulk SMS, engage the internet, software, voice, ear, and equipment. Number two, we need to engage community resource mobilization persons. So these people are going to mobilize donors at village level in the outreaches, and the budget was 300 million. It will cater for facilitation, meals, megaphones, airtime, batteries, and public address system. Number three, we need to do publicity and purpose to make awareness campaigns. We need 375 million, so we shall do radio DJ mentions, TV adverts, IEC talk shows, and mobile education. As we said, we have a challenge of staff, so we need to recruit an additional 125 volunteers who are going to support blood collection and mobilization. And we had a budget of 137 million. This will get up for their transport and airtime for 22 days in a month. We need vehicles. Chair, I remember there was a ban on procurement of vehicles which included the UPTS, but as you are aware, most of our blood collection is from the community. And so we need robust vehicles to travel to the communities. We go to areas like Kasese, Bundibujo, Manafa, in those hills. So we really need sound vehicles And since the ban, UBTS has not procured vehicles, and all our vehicles have been aged. So we need to replace our vehicles. We need to procure 10 vehicles which are purpose-built. And we need a total of about 3 billion to be able to procure 10 purpose-built vehicles. This is very, very important because we cannot move to the communities unless we have sound vehicles. We have a very, very big challenge here. And then also medical supplies and reagents. We need to pay arrears to NMS of 10 billion. NMS has refused to supply reagents and medical supplies because of this debt, which was incurred in the budget of 18-19, whereby the Minister of Finance wrote to NMS. I think you've seen the letter, but up to now, the Minister of Finance has not made good towards this supplementary debt. We need additional feeding equipment to facilitate blood collection according to the COVID guidelines, and this came up to about 500,000. We need to get for big blood pressure machines, weighing scales, spring balances, pull boxes, infrared thermometers, Macintosh to cover the beds, donor beds, and chairs for social distancing because we have to maintain strict COVID regulations. We need personal protective equipment, so to purpose for safety equipment for staff and donors, and the budget is 493 million. We need to buy masks, gloves, washing soap to give our donors as an incentive, sanitizers, water dispenser buckets, paper towels, and liquid soap. In fact, like in Imbale, the PMO has been giving soap and masks to potential donors, and this has really motivated people to come up and donate blood. So we thought if we could put more money to this would entice donors to come and donate blood to be able to meet hospital blood demands. We need also donor incentives to motivate blood donors. You know, in Uganda, maybe I think many of you who are going for these campaigns, many of these people say you have something for something. So we have to motivate them. So we need 400 million to cater for meals, transport, refund, soap, pens, t-shirts, and masks in order to incentivize these donors to be able to donate blood. And we also need to recruit critical staff. We need to fill the vacant posts for blood collection and processing, and this needs like about 1.1 billion. We have vacant positions for nurses, lab technicians, blood donor recruiters, donor clerks, and engineering assistants. We have written to Health Service Commission, but we are yet to get a response from them. We also need to create repository distribution centers at selected district hospitals so that we can take services near to the people, and this would be able to the purpose to manage blood supply management. So we need about 2.9 billion to cater for the lab cold chain, equipment, fuel, transport allowances, and data tools. We need also to procure additional blood processing equipment in order to increase blood component production, because you know 1 unit of blood can save 3 lives if we prepare that, if we separate that unit of blood into blood components. Red cell concentrates, 1 unit can give 3 units for children, and can also give 1 unit for platelets. So that if we separate this blood, then we can be able to provide more components to patients and be able to meet hospital blood demand, and even for the patient to get only that component he or she needs. So we need to buy centrifuges, plasma separators for all regional blood banks. Then, of course, we also need to do technical support supervision to provide technical guidance during collection, processing, and clinical interface. And this needs about 800 million, because we have realized that many of these hospitals don't know how to use blood appropriately. So we need to constantly supervise, guide, and advise on clinical management of patients during this COVID period. So, Chair, and my Minister, that is this is the critical, I think this is the most important page that needs to be the one for money that needs to be looked at. Otherwise, thank you very much.
Yes, Honorable Minister. Yes, thank you for your presentation. I now invite comments from the Honorable Members. Yes, Honorable Ruth.
Thank you, Chairperson. Allow me also add my voice in thanking the Minister and her team for the response. I will start from page 2 of the presentation, and that is fewer blood donors as a result of the closure of the schools, institutions, churches, and all that. And for me, my question is, isn't it high time we opened up these places? Do we still need the lockdown? Because we are missing out a lot from these institutions. Where I see things are, I think we need to open up. And secondly, on page 3, the first slide, where you talk of provisions of PPEs for donors, staff, and volunteers. Much as we are advocating for these donors and all that, I would be very, very much interested in knowing how many PPEs have been given out, especially the face mask for the general public. And then I come to the budget, this additional budget. I am aware that the ministry has received so far 2 supplementaries. I don't know how much, what percentage has been given to UBTS. And then secondly, when we look at this particular budget, which is talking about the PPEs, with a total of 493 million, 450,000, and we are talking about masks, gloves, washing soap, sanitizer, water dispenser, buckets, and all that. Are these additional? All this was never planned for. Because my imagination is, with the blood donation, when the team goes out there, these I would say a must-have items. So are these additional? Because I don't see anything like additional, but I'm seeing PPEs. We are now in July. We started having the case of COVID way back in March. So up to now, if these things are not there, then it worries me. I get so worried if up to now, these are actually, for me, I would say a must-have before you go out there to even collect blood. So I just want to know whether these are just additional or you never completely planned for them. Thank you, Mr. Chairman.
Honorable Aceng. Yes, any other questions? Yes, can you be? Yes, yes.
Thank you, Chair.
National Dialogue.
Well, thank you so much, Chair. Thank you, Honorable Minister and the technical team. Honorable Minister, by introduction, I am from the flooded Lake Albert area.
Maybe you introduce yourself first.
Yes, by introduction, Bulisa Bugungu is the lowest area of the Lake Albert. All the water from Lake Victoria and Venezuela is reported there. And 1,200 families are submerged, including their pit latrines. So I would like to inform you through the committee that we have a looming epidemic. It could be dysentery, it could be diarrhea, it could be cholera, because we have that challenge. So I would request immediately the team comes over, where one of the health centers, Health Center Srivutiawa, is also under submergency. The staff quarters are already gone, and the OPD is under threat. Particularly of concern is that the 4th month of COVID, we seem to be moving beyond just the prevention challenge of the epidemic, which has since become pandemic and now endemic, hitting the economy, which is the other blood which health needs. We are very worried that unless we start looking at things in a holistic manner, the other blood, the marrow which makes the blood, the economy may not be there to give us the drugs we need tomorrow. I don't know what the National Task Force, your technical team and political team is coming up in as far as what the speaker was talking to in terms of the new normal. What is that we can do? Because some of us are now worried. In the next 6 months, we will not have money even for the protective equipment, for all the needs. And there seem to be other diseases which are now having a bigger toll than COVID, because all the attention is on COVID. I would want through this Committee of Health to assure us that we have not been diverted to only discuss COVID, and yet there are other much more lethal diseases which could be hitting us when actually we have been diverted to look at. So I thought through you, Chair, that beyond the committee mandate of today with the Minister and just looking at the budget, for me I come from a planning angle and from an economy angle. I want us to look beyond what has been given. So can we start addressing the other areas so that we don't get stuck tomorrow, because the economy is dead, the other ills are killing people, and we are only discussing COVID. Thank you, Minister.
I guess those are the questions you have so far, but I would like to know from Dorothy through the Minister, how the performance compares with the previous years. I'm not yet satisfied that there is a real 76% is different from the performance of 18-19 in the same quarter. Do you have figures for that time? Or 17-18, the performance could be close to that. Can you qualify the underperformance and attribute it to COVID with the figures? But can answer. Yes, can she answer those ones and then yes.
Thank you very much, Chair. Chair, I appreciate the members for the question. And the first question came from the woman MP of Amuru, which is one of our hotspots. I am surprised that she's the one to raise this question, knowing that her area is not doing very well. And we are sitting on the edge of our chairs trying to find out solutions to Amuru. Nonetheless, Chair, I will respond. The issue of opening schools, churches, and others, salons, borders, and the like. First of all, we must take note that there is a national task force chaired by His Excellency the President. And just like any other nation, when you're easing a lockdown, you don't just open without planning. There must be planning. And there must be plan A and plan B and C. We have seen countries that have opened up lockdowns and they have run to lock up again. If you've been reading literature, I am sure you saw what happened in South Africa when they opened up schools. They had to lock up again, and the number of cases are soaring uncontrollably. Our neighbors here in Kenya declared a complete dead year. Even then, with the closure of schools, they are not doing well. We must appreciate that God has been on our side, but also our teams have worked very hard day and night. To date, Chair, we have 1,004 recoveries. It is a record internationally that we have achieved with no death up to now. We have to be appreciative. Nonetheless, I am not the chair of the National Task Force, but I will tell you what the National Task Force is doing. All these areas that are currently under lockdown are under consideration. There have been a lot of planning meetings with the different individuals, a lot of pilots, teaching people how to live with the disease and what to do, so that in the event that His Excellency decides that they are opened up, it is not just opening up, but opening up when we are certain that we are ready to handle any emergency, and they are also ready for prevention. This has already been done with the border groups. We have concluded with the saloons. We are working with the churches. We are looking at the mobile markets. And all the SOPs are being considered by the National Task Force. What we require is a little patience, because the training has to be cascaded up to down. These things are not only in Kampala, they are up to down. Many of you may have seen some reports yesterday on news about assessment of arcades and so on, the ones that we can consider, the ones that we can't consider. All this is being taken into consideration, Honorable Lucy. We just need patience. We have come this far with no death. We must ensure that when we open, still there is no death. The apparent lack of death in Uganda is giving people a false picture. You can just step out of Uganda and you see what is going on. But it takes work. If numbers increase uncontrollably, death will occur. Right now the health workers are holding in there, but they are getting tired. And as we plan to face the lifting, we also have to be cognizant of people who have never gone back to their homes. They are in the hospitals, inside there, from isolation to a nearby place, to ensure that nobody dies. So all these things are in the process. At the right time, the chair, who is His Excellency, the President, will make his statement. It is not my statement. The PPEs, obviously, Chair, we appreciate that His Excellency, the President, also worked around the clock to mobilize industries in Uganda to manufacture PPEs. And we now have this being produced here, and we are getting them from our own suppliers. To date, we have spent over 20 billion on PPEs alone. But this short period of time, the change in financial year, has been a bit of a challenge because of lack of resources. But the PPEs are available. The masks are available in country, the coveralls, the gumboots, the aprons, the face shields, you name it. Now, when Honorable Lucy asks about face masks, I am assuming that she's referring to the fabric face masks, like the one she's putting on.
I think the ones they promised to distribute free
yes,
to all
those
Ugandans.
are the fabric face masks. The distribution is ongoing. To date, we have covered about 20 districts. It has been slow. The output from the companies is a challenge. They are trying their best to ensure that they give us the required number. So what happens is whatever they bring to the ministry every morning is supplied to the districts. The output needs to be increased, but the agreement was that 60% will be handled by the big industries, 40% by the women groups. It has taken a bit of a while to mobilize the women groups. They are available, but how to get them contracted into the system has been a bit of a while, and Honorable Nabanja has been working on this. She will be contacting all of you to give the women groups who can do this. So it is a process that we are undertaking, but the commitment is there. The supplementaries she will respond to, and the issue of the PPEs that she's requesting for, she will respond to. I will respond to the issue of Bulisa. Honorable, we are aware about the challenges in Bulisa, and we have already set out plans to address that, but as you are aware, that is a major disaster that health cannot handle alone. We can handle our part, but we need the office of the OPM to come in and support us to address the issues. Our teams already visited the area, and a plan has been drawn for what we need to do, including addressing the issues of cholera and malaria, and also clean and safe water, working together with partners. Perhaps at an appropriate time, we'll have to sit down with the members of parliament from that area and forge a better way forward. For the other disease components, I'll request the Director Clinical to respond. We have a comprehensive plan that is being implemented. So perhaps you start, then Dorothy will come in.
Since it's more technical, you can also tell us the specifics, like how many masks have you distributed? And which districts are those 20 ones the minister has mentioned? But if you are not comfortable, you say, hey, supplement him.
Yeah, thank you, Chair. I wish to supplement a question on that very one. Apart from the number, the list of districts, I would like to know how many masks we are being given to female. And yes, how many masks we are being given to each family, to a family, yes, and to each household. And I would like to get, if you have any comment on the quality, the size and durability of those masks.
Okay, about masks. If only 20 districts, like you said, the Honourable Minister have received masks, how long then will it take for Ugandans to get masks? Especially now that we are getting closer to campaigns and that we have started seeing excitement. Primaries are on. The other day we had you say people got excited to see Mama Corona. Now what will happen if people here, they are MPs in the village? Won't you think there will be excitement in that village, in that trading center? So how long will it take for these people to get mastered? When we go down there, people don't get excited and come to us, and we end up in a situation like we saw, where people are around you and without masks. For now, let me stop at the masks.
Thank you, Chair. Through the Minister, I wanted to respond on the aspect of other services other than COVID. As part of the national response, the ministry constituted a specific pillar to address the continuity of essential health services. And this national pillar is replicated in each of the districts. They have a subcommittee to address the aspect of continuity of care. And we have given them their specific indicators which they monitor and work with the different partners in the districts. And we have a meeting, 2 meetings every week There's a meeting on Monday where we have all the partners, and then on Fridays we meet with the different partners who are working with the districts in the different regions to address aspects. We have looked at the indicators for malaria, indicators for maternal health, and definitely the outbreak had effects on what? On the consumption of immunization. Chair, we have all those services. We have been able to look at them and see what is the effect of the lockdown on them. So we are following up on all of them, and we have instituted corrective actions in each of the special districts. The ministry specifically recruited additional staffs because we didn't want to remove the staff from addressing the other facilities. And that's why you've seen that we've gone ahead to do indoor residue spraying. We are distributing the mosquito nets. We're also preparing for yellow fever vaccinations. All those are intended to address that the other services are not affected during this time of COVID.
Yes, supplementary on this. I'm not. It's good you interjected a question. I expected one of the interventions would be more of a preventive primary health care approach, but more so immunization. In the 4 months, are you sure we have not lost out on immunization? And what corrective measure have you done on immunization in particular? And then the HIV patients, have they got their drugs? Because it has been a problem. I had to talk to World Vision in my place and other partners to start working with civil society and reach out to people. And I don't think that correction is nationwide. So I thought we would get a much more elaborate finding and correction.
Chair,
And maybe, Chair, just want to add something to this. Something small to add on what
on
you said.
HIV, I want to just give some information from Amuru.
Okay, that's good.
Thank you, Honorable Minister, and I really appreciate your work. It's not that I don't know, we know the struggle we have come through with Amuru, the challenges at Ilegu. That's why I said the woman MP for Ilegu. Because I got a very worrying information when I was for a district task force meeting in Amuru. Overall, the enrolled on the ART in Amuru, 2,088. But they told me out of the 2,088, 392 had dropped out because, one, they're saying they don't have food, enough food, and as I speak now, 3 have died because they were very vulnerable. So this is something very, very serious. When Honorable Stephen talked about the HIV, I am actually very worried that after COVID, we will conquer COVID, but after COVID, we're going to see very, very high rates of infections because when people are not on medicine, it means they can easily infect others. I may be wrong, I'm not a medical person, but that is the little I was told. So this worries me a lot. 392 for me is a very big number, and this is just one district. What about other districts in the country?
Let's say something.
Thank you, Chair. Greetings to the ministry team. Mine, I was adding something to Chair. 2 weeks ago, I was in Luampara. We had gone as a quality health forum. There is a health center, it's called Ramushore. It's a health center 3. That's side of Kinoni. And the clinical officer in that place was denying a certain lady ARVs to refill. She was like, no, I came this side. We are stuck. Actually, Honorable Imwa had to come in and intervene and said, no, we cannot live here, not until this woman has been given the medicines. They were telling her she has to go where she comes from. And when we asked her, she was from some other place outside the Mbarara. And he was like, no, I have no transport. How do I get ARVs? So I think in ministry, you need to take this service, just take it up. And it wasn't a good thing. This woman cried. We had to make sure this medicine is dispensed. And again, another one was for TB medicine. they were denying also that patient medicine in the same facility. So I think the ministry, you have to make really a serious follow-up on this.
I propose that we request to the minister that the Director of Clinical Services gives the committee a report on the effect of COVID on maternal health, HIV, TB, immunization, and malaria, and a few related services. And we get a clue, because now there are many challenges which you may skip here and not have an adequate response or even adequate supervision. So as you respond, I think take that as a request to the minister, and then an instruction to you, Dr. Lara, now to produce that report.
Mr. Chairman, I think you're right to move that, to guide in that direction. Because I've heard people say nobody has died, and yet people are dying because of the COVID situation. And the ministry doesn't want to talk about that. They're just happy that nobody is dying of corona. So are we just looking at people not dying of corona or people not dying in the country? If many people have been dying because of the situation, it should be our concern as a country.
Thank you very much, Chair. I apologize, Chair, for coming late, but there was too much traffic. I couldn't really make it. Chair, what I wanted to comment, I don't know if it has been said, you can guide me. In case it has been said, you can...
primarily discussing the challenges of blood.
Yes, but when the minister is here, sometimes we chip in to pass something.
You want to talk about Lira or what?
Not Lira, that is another business, another day. Chair, the issue is about the donated items at the ministry there. There have been a lot of items which have been donated to the ministry. And one time, I witnessed something which I felt it was not normal. When that day, it was AAR which brought items. I stood there like any other person, just to watch near their parking there. So when they brought the items, the person who was receiving was like, and again picking up, it's like there was no order as they received, they didn't know where they take. I observed, I said, now, so which means someone can receive this. There are no cameras to see who is taking this. What have you received? Me, I'm taking this on where. Then again, another person, another company came. I said there was a problem. That's why, if it is possible, we really also need to know the items which came directed to Ministry of Health, especially the medical supplies, consumables, how were they distributed? Because recently, even the milk, people were saying the milk was expired, something like that. How can the milk expire? Lastly, Chair, is about the issue of the ITNs which are being distributed. Maybe, Honourable Minister, we could be having an idea on how much is supposed to be paid to the people participating in that exercise. Because yesterday I was in the constituency, and for the last 2 days, they have not been distributing nets. Reason, one sub-county is paying VHTs 12,000. Another one is paying LC1s 14,000. So what they did was to put the tools down. So we need to know who is responsible for such facilitation. Here I need to pass it.
Can we first conclude our blood issues anyway? Yes, we first conclude blood and then we go. Yes, Honourable Minister, can we conclude our blood issues with the Director, and then we can go to those other issues because we shall get lost. Yes. So blood, Dorothy, respond to the questions of blood, which we are said to you, and then we agree that we go to Budget Committee.
Thank you, Chair, through my Honourable Minister. The issue was raised about the performance for 1819 vis-a-vis 1920. I have the graph here, I have the performance here, and it shows that in 1819, the total collection, the target was 300,000 units of blood. From July to June, we collected 274,308 units of blood. for that year. For 2019-2020, as you can see, despite the COVID pandemic, we have collected 288,663 units of blood. So that means if there was no COVID, we would have performed better than the previous year. Because already within even the COVID period, we have surpassed the collection for the previous year. So this was better performance if there was no COVID. And now, regarding the PPEs, you know, we are requesting, because we are dividing our teams into smaller teams in order to conform to the COVID guidelines. So if we have a staff of 10 people, we divide them into 3-4 people so that we practice the social distancing, so that we can approach those donors. So that's why we need more. We need more than what we already have. Even then, when we are collecting blood, we are not giving donors masks. But now we are giving donors masks. We are giving donors washing soap to incentivize them to do, because they need this also as a protective measure. We are using sanitizers more frequently because each donor that comes to the donation site has to sanitize, has to distance, so we need to create more space. And that's why we are requesting for more PPEs so that we can be able to collect more, we may be able to make sure that we fulfill the required guidelines. So that's why we are asking for more money for PPEs. Of course, the ministry has given us, but we still need more because every day we go out in the field to collect more blood. And we are planning, because we don't know when this COVID will end or when this lockdown is going to end. But only to tell you that it has really affected our activities. It has increased the cost for unit of blood because of all these measures we have to put in place. Traveling long distances, social distancing, getting tents, getting into smaller groups, and even e-recruitment itself, engaging donors on phones, transporting donors from their places or from their homes to the donation centers. It is really not a very easy task. And mind you, each donor has to donate. The next donation will be 3 or 4 times. We wrote to the military. We went there one time at the beginning of the corona period. But when we wrote again, the Chief of Defense Forces said no because of COVID. So I think, members, through my minister, I think we need to find solutions to this blood issue.
Yes. Yeah, I thank you very much, Chair.
Yes, first finish. Let him first finish.
The 10 billion supplementary.
Oh, the supplementary budget.
The supplementary, is it the 10 billion?
No. When we passed the budget, supplementary budget for COVID, did the blood bank receive any?
When the blood bank was given 2 billion shillings to procure reagents, reagents for testing blood. Then we thanked the ministry. They gave us some allowances for staff and some money for fuel. We got about 23,600,000 for fuel. And how much for staff? And for staff allowances, I can't remember, but they got allowances which was based on the 50,000 category per staff.
Thank you, Chair. Proceed. Let me. Okay, thank you very much, Chair. Thank you, Minister, and the Director of Blood Bank for your presentation. I have listened to you and followed your presentation, and at the end of the day,
you are requesting for money, but you have said it in your own words. We don't know when this COVID will end. Honorable Ruth, when she was asking the minister when will the lockdown end, most of these challenges we are getting them because of the lockdown. And when the minister was responding, she referred to the national chairman, who is the president. Of course, is the one to guide the country on when to lift this lockdown. The president bases on scientists, because he has already said, when scientists advise me, I'll do this. This morning we got, there is a WhatsApp post I got. A director of Mulago Hospital, who is a scientist, who is a doctor who has been treating these COVID patients, saying that it is high time we lifted the lockdown because we have serious illnesses. And he's saying that the COVID we have in Uganda is mild, it can be treatable. So, Madam Minister, the President, the National Chair, who is the chair of the COVID Task Force, whatever decision he makes in terms of lifting or easing is based on science. And we have this doctor who has been at the center stage of treating the patients and saying the COVID which we have is mild. And when you look at this budget, if COVID is here to stay, because most of the challenges we are having because of restrictions, that's why we're not getting blood. So we have the 20 billion here today, tomorrow you will come for another 20 billion, so that means it is not sustainable. So if the doctor is saying we have a mild COVID, so why don't you think about it? And yeah.
Chair, addition on that one, not necessarily that I'm also pushing for opening schools tomorrow. One can say it's conflict of interest.
Yeah.
But we have friends and colleagues abroad who have been infected, treated with COVID. And they have never gone to a medical center. They have got services. Residents, you isolate in your home. You are treated at home. I have more than 5 in London. I have some in the US. I have a boy in the and they have told us what they have gone through. Why do we think of institutionalizing all? Who brought this idea? Was it a panic mode? Have we outgrown that panic mode now that we can become real and say you can be handled at your home, get the right treatment, isolate, observe the SOPs so that we stop this institutional stress? Because what is happening, the moment you think of putting everybody in ICU, then you cause a problem. So in line with that, Dr. Bibi's, I read it actually, Dr. Bibi's argument, that we are focusing too much on COVID, the mild COVID, but they have a lot of other things to attend to. They have been diverted, and that's the spirit I raised my first concern. Chair.
Well, now I think let me conclude the blood issue and shift to those issues. When you look at the budget, there is a 10 billion debt, so we remain with about 10 billion. Then there is a capital group, there are vehicles for 3 billion. And then there is staff for about 2 billion. So what they are in effect asking for is about 5 billion shillings. So I propose that we go and support them in the budget committee, and they get, because the COVID is the new normal. They need to sanitize, they need to do things in a different way. So I don't know what members say here, because the blood, we shall need it. When we open, we shall even need it more. Yes, Honorable Lucy.
Honorable Chair, I want to support you, and that is why I personally was very much interested in knowing what percentage of the supplementary the blood bank receives. And that would be our starting point to negotiate with the budget committee.
So the chair's motion has been seconded by Honorable Lucy. So we can now allow. We want to conclude this one and go to the other.
It's on the budget itself. We'd like to have a specific figure of how much they need for blood collection, because it's all mixed up.
We'd like to know how much is needed.
I think that will be processed in the budget committee. But I think in principle we agree that we need extra in order for us to continue surviving. But now, and I think we leave that subject, and then the minister responds to the leader issues and all the other issues.
But Chair, those issues were not on your agenda.
It was part of AOB, Madam.
Yes. But nonetheless, I will respond to the ones that you have raised. Let me start with essential services, because my director did not seem to have the figures, but I'll give you the figures. HIV and malaria TB services were uninterrupted by the lockdown, because the partners, the various partners we have, and the implementing partners oriented themselves to handle the challenge and ensured that patients continued to get their drugs uninterrupted. Drugs were being distributed door to door to people who were sick for HIV, TB, and malaria. For HIV and TB and malaria. Now, the number of malaria cases diagnosed and treated increased by 56% between January and April because of the increasing malaria incidence due to the floods. Antenatal care attendance decreased by 7% between March and April compared with the same period, and this mostly affected northern and southwestern Uganda. Health facility deliveries also decreased by 10% between March and April compared to the same period in 2019. Immunization services were affected across the country with a 20% drop in the number of children receiving DPT. We have the statistics. Now, you also requested for the districts where we have distributed masks. I'll give you that, and the total number of masks distributed. I'm sorry that we are using this technology, but you had not alerted us early, so we had not prepared the information. No, but you talked about blood. You didn't bring these things in your letter. So I'll give you the list of the districts. You want the districts and the amount of masks distributed?
To each district and the estimated population you had for that district vis-a-vis the number of masks distributed there, because
you need to take note that the population that was estimated are from 6 years and below the age of 65 or 70. I don't remember the age. So, yes, all districts, because the elderly and the young are not receiving masks.
Yes, but statistics per district, because if you are going to give
I cannot remember the statistics in my head, but I'll give you the number of masks.
Okay. Can we allow the minister to read the districts,
so,
maybe, and then the total, and then the full detail?
Amuru got 171,944 masks. Chotera 209,300. Buikwe 376,005 masks. Arua 595,616. Ajumani Chair. Reading all these figures, no one will remember them. Let me read the districts. Amuru, Chotera, Buikwe, Arua, Ajumani, Singiro, Raka, Ibusia, Moyo, Tororo, Gulu, Hoima, Mtunga, Moka, Kumiro, Masaka, Kumi, Moroto, Lira, Mbarara, Yumbe, Soroti. And so far we have distributed a total of 6,031,738 masks. Now, on the issue of donations to Ministry of Health, I think the question should have been donations to the National Task Force, not to the Ministry of Health. There was a committee that was set up to receive donations, and this committee did its work. And Chair, for those who listen to radios, TVs, and televisions, the Permanent Secretary went and gave the population an accountability of everything that we received. What I will do, I will just get a copy of that accountability and hand it over to you so that you can even know where the eggs and the matoke went, because we have information on all that. Now, I think on the issue of the people dropping out of heart, this is not true. Because at the beginning of the pandemic, we sent out a circular that people are free to get ARVs anywhere, as long as they can produce their numbers and their names. And this is what happened, and this is what the partners followed. So they were giving them the medicine. But it is true that some were not taking the medicine. Food is not our issue, Honorable. I cannot answer for food. But God has been faithful. We have rain. People should be digging. We have too much rain. But Chair, of the questions, the payments for the mosquito nets, you answered.
Chair, the VHTs are paid an SDA of 12,000 per day and 10,000 transport for 5 days. They also get gumboots, t-shirts, sanitizer, an apron, and a mask. LOCs are paid 12,000 every day and a transport of 1,000 once. There's also the training money for all at 12,000 shillings.
Chair, maybe I will request through the clerk, we get this copy, because whatever I'm hearing, it is new to me, who has been seeing net distribution in my
You are not the VHT. Okay.
Chair.
The VHT coordinator for Chiboko.
Chair, there is this one here. Okay, there is this one.
Okay.
Honorable Chair, I think you may recall very well, during, when in the COVID outbreak, the pandemic had just been intensified in the country, we used to get daily updates about COVID. But it's now coming to some month, we no longer get official written updates. We only get just like a WhatsApp, but those days we could get the official document signed by either Dr. Olal or Webesa. So we no longer get those updates. So I'm really wondering, Honourable Minister, maybe what went wrong? Does it mean COVID is, as they are saying, it's now becoming like jiggers in other places?
No, Honourable Minister, supplementary to that one, the Speaker directed that every Thursday, every week, the Minister should update Parliament on what is happening. I think you have not been doing it consistently. The Prime Minister.
Yes, thank you, Chair. Again to the Minister, she may decide to answer today or in a report wherever, but I'm concerned about the size and the quality and the number of masks that we are given to each household. I'm from Chotera. They launched it from Chotera. They gave 2 masks per household, regardless of the number. And this is the reality. To my home in Rankoni, they came and I was there. They gave us 2, and we are 9 in the household. And then when they started putting on, my husband's head was big. When she put on the thing, it broke. The size was the same. And when I moved in the community, I started finding the strings were breaking very easily. And the size, and I don't know, the quality, the size is a problem, and the number given to a household. We started saying, whoever will be going out will be borrowing this one for you, that the 6 of you stay in the household, and this one goes with this. If the intention of the masks is to avoid contracting COVID-19, how are you going to do it?
The presidential directive was a mask for everyone above 60.
Yes, in the household.
Supplementary.
So you are portioning. Yes.
I'm talking because Bagamoyo is one of those districts that receive. We also receive the masks. Yes, I have confirmed that data. But as we were trying out, as we were trying out and sampling on one of the members, we tried almost 5. It couldn't fit his face. And also we also received the concept about a household getting less. They can come and decide and give 2 masks, maybe 3, even when there are more than 2 members in that household. The truth is, when it was being done, when the first mask was being done, I remember especially for the community, I said, you're less, you can't do for it. But once you discover that these masks are filled, then we will make a difference because they will be used. And also the quality really was not, and it's not the best. I already submitted my items in the office. So this is perhaps we need to engage the women's group even more than this, the big companies. Because I am assuming these women will have better quality than these other. So for me, this is much of much. I'm more comfortable with it. Because made by a woman, a single woman out there, it has 2 layers, just like that, 5 people there. So, some my wife can fix it, you don't make her fix it. So, I think if they advise the women to put the advice, they will do a better job than these commercialized people, the 60%.
Yes, finally, Honorable Commissioner.
Thank you very much, Mr. Chairman. Of course, Mr. Chairman, still I was concerned about how much so far has been spent on procuring these masks. And like I said, I think you didn't respond, the Honorable Minister, about our interaction with the public. Now that we are not sure when they will be able to, all of them, get masks, and campaigns have set in. If people have come to me like they came to you and it was just excitement, will the excuse be that, you see, I did not invite them, they just came, they heard that I was around and they came, so what can I do? They came to see Mama Corona, they have come to see the Member of Parliament. What happens going forward?
Honorable Minister, please respond.
Thank you, Chair. Chair, masks are made in 3 different sizes: small, medium, and large. And it is the responsibility of the district task force to note the different boxes, how they are marked, and give information to the VHTs accordingly to distribute per household. The number per household should be the numbers of people in the household. If this was not done, then it is a big mistake that needs to be addressed. But in addition, Chair, the truth is that no district received any money to distribute masks. No district. So they are struggling. For those that have done it, they have done it under a lot of stress. It is an area that we all need to look at together and make sure that funding is provided to the districts to distribute masks. The issue of the quality, I will carry it with me because I don't have opportunity to see every mask. Maybe they bring for us samples that are good and then the others that are packed are not good. Well, I'll request my teams to pay much more keen attention. How much has been spent on procuring masks, Chair? No money has been spent on procuring masks because we have not received any money to pay for the masks. So far, the companies that are producing the masks have not been paid any money. We have only received a letter from finance that they will be able to release some money in this quarter beginning for the masks. So up to now, there has been no money. However, we have been engaging with the companies, but as I told you, we need the women groups to come on board so that we can quickly boost up the capacity. And work is already going on. Hopefully by the end of this week, we'll have the women groups to come and boost the capacity of the other industries to produce the masks. These are the questions.
Responded to his question, but also the final one from Amori.
Yes,
the Commission.
Honorable Chair, you will bear with me. You know, the Honorable Minister stated very clearly, Amuro is still a headache, and particularly Elegu. I was very, very impressed, Honorable Minister, the other time when you launched the 2 machines, the testing machines, that were donated by the German embassy. You will correct me if I am wrong. I watched it on NTV, I heard the news on KFM. On NTV, they said it is meant, one of the machines is meant for Elegu, another one for Malaba. On KFM, I heard that one of the machines is going to Adjumani and another one is going to Malaba. So now, this is creating a lot of confusion, a lot of tension in Amuro, because the team at Elegu is getting a lot of stress, taking samples every day. The other time, actually, the team was involved in an accident, and I'm sure you are aware of it, when they were taking the samples to Adjumani. So we are saying, okay, Adjumani already has a machine. Why another second one? Why not at Elegu to make their work easy? So I needed this correction. I tried calling you. I'm sorry I'm raising this here. I tried calling you. It was not successful. So I am very happy that you're here. An opportunity has presented itself to you because this is creating a lot of anxiety. So help me clarify this and save our people because there's just too much anxiety. Thank you.
But just one. Honorable Minister, I'd like to get your response concerning the quarantine center. Because we understand we appropriated a budget for you, to the ministry itself to fund the quarantine centers. But as I speak now, Shotera district has never got any money for quarantine centers. I don't want to mention the rest of the areas where I've moved because I've moved nationwide. But let me speak for Chotera. Jaja Banga that was there, we went there with the team and we closed it. As I speak now, the contacts that they get, they have nowhere to put them. And the cow is literally crying because she has nothing to do, she has no money. So what is your plan?
Yes, Honorable Minister, you want to ask your question?
No, I don't have to ask again because I am waiting for an answer. I think I asked already. About the...
Has forgotten the question.
Oh. I talked about the campaigns that were about to go in. I said we are already into primaries. There's a lot of excitement. Yourself, you already engaged in campaigns. We saw you without masks. And I said, and the reasoning from what you said was because people got excited and came to see Mama Corona. And so I said, if people will get excited to come and see the member of parliament, the candidate, I mean, how do we, as an expert who has advised on these campaigns, because we are told it was your advice, you the scientists, how do we go about these things in the absence of masks?
Thank you, Chair. Chair, I will begin from that question, and I thought I had been answering it by saying we are trying as much as possible to bring on board many other people, to produce masks, so that we can meet the timelines. But all this will also depend on availability of resources. Much as we are pushing for increased production, so that we can also meet the pace of distribution, it has to be complemented by the necessity. The Ministry of Health has already lined up vehicles As I said before, whatever masks come, we take them to the districts immediately. So we are working around the clock, Chair, and hopefully, if we conclude with the women groups, we will have masks out there as people begin to go out. But like I said, we also need money for the districts to distribute the masks as well. On the issue of the quarantine centers, first of all, let me state here that initially, the support to the quarantine centers were from donations. Money was never provided for quarantine centers. So the food that was being donated by communities in Uganda is what was going to the quarantine centers. Thereafter, we placed a request to Ministry of Finance, and we read this on the floor. We requested for 5.2 billion. We've not received it. So what the permanent secretary did was to write to the cows to look for willing suppliers to continue supplying food as we wait for finance to provide the resources. Now, on the issue of Elegu and Malaba, my sister, Honorable Lucy, I have severally explained this issue. The launch was a later launch. The equipment was already with us and it was already functional. We had already deployed the equipment, but we had not received it formally, and the East African community wanted to be involved. That's why we had to have a formal launch. The equipment for Elegu is still being used by Elegu. But at the border of Elegu, there is no facility with a biosafety cabinet box where you have to put the machine and perform the activity. That is why it is deployed in Adjumani, because the hospital has that. Similarly, the one for Malaba is deployed in Tororo. It does not mean it is not handling that business, but it is deployed where it is supposed to be. If we just take it out anywhere, it will not be responsible of us and it will not do its work. But it is still for a Lego. It is only hosted in Adjumani. That was the launch. The equipment is already working.
Okay. Allow me, members, to thank the Honorable Minister and her team for coming to interface with the committee. Hope we have got the information we wanted. And thank you all for coming. I think we allow our visitors to leave, and then we briefly discuss. And then I thought Chote and Amoro would escort, but the coordinator of VHTs from Kibuku wants to escort the team. Thank you.
Akaliwo tabero chichi ida tuje
the Public Health Act and the regulations that your ministry and you yourself, your custodian, too. What is your take on this? Some are even calling for your resignation. What is your comment to this?
You mean in relation to what happened in Lira?
Yes.
I thought you as the media people, you have access to social media and everything. You should have been very critical in going back to the procedures and processes that took place there. I was training on masks, and the people who decided to take the photographs took it at the end when people are excited about seeing Mama Corona. Look, if your daughter, I am their daughter, if I go down to the ground and they have never seen me and they see me, won't they get excited and move near? Should I request the police to push them or arrest them? That would not be nice. If I am vying for a political position, I have to handle people nicely. And it is not in my manner to get people to be arrested in the wrong way. So I took the opportunity to train them, and I told them, please keep calm and understand the importance of masks and the importance of social distancing. They went back home happier people with their masks. So I did a good job, in my own opinion. But of course, it is a time of politics, and any political opponent will pick that up and flash it all around.
The same scenarios or same circumstances are likely to happen to other people, politicians.
Yes.
And they will seem to be violating the same guidelines as you're presumed to have done. What would be the message to the security agencies?
Of course, obviously, for me, it was a good lesson, knowing that moving into the political arena, I'll be faced with such scenarios from time to time. It is important that we pass on messages very clearly to the population that this is not a time for gathering, it is not a time for crowding. And we need to be very tactful in ensuring that we engage only the required numbers of people as per the SOPs. And we have been very clear about this. The SOPs are being worked on by the Electoral Commission. It does not allow gatherings of more than 50 to 70 people. You can do that comfortably if they sit down and they are listening. All the political people will have to adhere to those SOPs. I mean, right now, there are many ways of engaging people through social media and other online innovation ways of reaching out to the population. You can have recorded messages move around in forms of tracks. You can have messages sent out using the megaphones. And you can have other means of reaching out to the households using the VHTs and the local councils. I am pretty confident that the Electoral Commission has worked this all out.
Maybe, Honorable, lastly from me, Honorable, there's a video of a procession which clearly shows that you are not demonstrating anything to do with wearing of mask.
Yes, the women received me. They were so happy. Their daughter. That is my home area. And immediately I disembarked. They were so excited. I told them, please put down the leaves. No. It took a lot to convince them to sit down. So as I said before, that is a lesson for me. So I have to prepare before I go out to people who are happy to see their daughter. Any other question?
Minister, some people... You regret the incident. Oh, anyway, will you apologize? Because the public is asking.
Actually, others did I do anything wrong?
That is what they are asking.
That is the question I'm asking you. Did I do anything wrong?
They are saying you flouted the guidelines.
I think that video where the women were dancing, I had my masks on and I did not have contact with anyone.
But they had contact among each other?
Yes. That is why I took off time to train them, to talk to them. If I had just ignored them, that would be the wrong aspect of it. The other place where the youth crowded, I also took off time to train them. And in any case, I had gone to launch masks and to train them on masks.
So we shouldn't expect any apology.
Isn't this setting a bad precedent to other politicians who are vying for political positions from a Minister of Health?
No, but I have clearly told you that it is a lesson that I have learned, that before you move out anywhere, you need to have prepared that area adequately. This is what I have said. I am not saying that it should happen anyhow. No, I'm saying we need to prepare early. Now, if the electoral roadmap is out and people are going into campaigns, before you move out to any districts or any constituency or any sub-county, they need to be prepared adequately, and you only go to that targeted area. And I am sure that security will be around to help us. Thank you.
Priska.
There's a computer there.
There's a free computer here.
Hello members, unfortunately we are not really able to sit because there is someone who is going to
Item number 2, communication from the chair.
Honourable members, I welcome you to this afternoon sitting. One, I'll be altering the order paper to create room for the motion to be presented on the issue of the sugarcane, as we discussed yesterday. Secondly, I wanted to remind the Minister of Works and Transport about a petition by Honourable Michael Timuzigu, presented first on this May 2019 from the residents of Karagama Town Council in Tungamo on the compensation of the project affected persons on the Tungamo Kagamba Road. We sent that to the Minister in May 2019. In July 11th July 2019, the owner member again rose to remind the House that he had not received the response on the issue of the payment of compensation to the project affected persons, and directed the Minister to respond urgently, but up to date he has not yet done so. So the Minister of Works directed to present an action taken brief on this particular issue by Thursday next week. And this is the last time we are going to ask you. After that, we shall have other options. Now, members, secondly, sometime back, the honourable members had requested that the Ministry of Health organize mass screening for COVID-19 among the members. I'm glad to inform that they have now completed screening the cabinet, and starting from tomorrow, we shall be able to do the screening here. Starting from morning, we shall first screen the staff, then later we shall screen the MPs, and then after that we shall deal with the staff and others. So starting from tomorrow at our medical center here, you can go and get tested, but we shall have to cluster you because we don't want all of you to be there at the same time. So the clerk will organize for how you can get in. Now, there are also a few matters of national concern. I think there was Honorable Nyakun, 2 minutes. Huh? Yes. Honorable, stand up when you're talking.
Thank you, Right Honourable Speaker. Right Honourable Speaker, I am one of the people who are excited about the announcement that you have made, particularly about the need to screen the members, including the staff. But Madam Speaker, I wanted some clarification on that, because first of all, the members here and the staff come from families which are just more than one member, and therefore during the day they are here, but the evening they go to interact with their family members. Just wanted to know from you, Right Honourable Speaker, whether there is also a way or a mechanism that maybe this could also be extended to the immediate members of the family members, because a member may be okay today and yet the member will go back and still be affected by a relative, especially the people who are there, Right Honourable Speaker. I want to thank you and seek for your clarification, Madam Speaker.
Okay, Honourable members, I think first let me deal with the immediate constituency here, but I'm going to engage with the ministry to see what else can be done to protect the ones who live with. Honourable Nyakun, 2 minutes, followed by Honourable Abbott, 2 minutes.
Thank you, Right Honourable Speaker. Right Honourable Speaker, the issue of national importance that I wanted to raise is on issues of open markets in Karamoja sub-region. The people of Karamoja have sent this concern because we know very well that these are markets where the locals from Karamoja are selling their goats they're selling their cows and the little chickens so that they're in position to get some foodstuffs from the market. At the moment, we are in the lean season. Since most of the gardens are now, all the seed was planted and there is no kind of food, having at the back of our mind that Karamoja is at 60.8%, an area where there is high poverty levels. So the locals have really requested, or the people of Karamoja requested, if they can, the district task force members should be able to work with them, the sub-county task force members, to help them to observe the SOPs, because it is really a very big problem. People cannot even sell even a mere chicken to be able to buy grain for their families. So I brought this as an issue of national importance, and I request that Ministry of Health and also the government should be in position to allow this and allow the people of Karamoja to have the markets open, because after all, we don't have corona in the region. Thank you very much, Right Honourable Speaker.
We shall ask the Prime Minister, who is the leader of the task force, to come and advise on the livelihood of the people of Karamoja in view of the long lockdown. Honourable Ouma, then Okino Ojara.
Madam Speaker, thank you for this opportunity. Madam Speaker, this afternoon, I got a message from the people of the islands that some unidentified people who are calling themselves the army are confiscating their engines in the pretext that they have life jackets, but that their life jackets are old. Now they take your engine in the middle of the water of the lake, then they leave you there to continue floating. So almost 7 boats are in the lake, the engine is taken, they don't have oars, they are there stranded. So my prayer, Madam Speaker, would be that the ministry concerned should actually come and clarify who are these people and why should you arrest somebody because his life jacket, you are saying it is old. It's also my humble prayer, secondly, that the government of Uganda, because people are suffering the lake, should maybe bring these life jackets at subsidized prices so that fishermen can continue surviving and not have to go through this barbaric, archaic and inhuman practice which is leaving them to continue floating and they don't have any food in the boats. Thank you, Madam Speaker.
The Minister in charge of fisheries, who I know is still on a tour of the fishing areas, directed to address the situation in the islands and come and update this House as soon as she comes back from the familiarization tour in the fishing areas. But also, I think the Minister of Finance should come and advise us how the islanders can secure life jackets at subsidized prices. Huh?
Yeah, thank you, Right Honourable Speaker. Right Honourable Speaker, Honourable Member raised very important concerns. And he's saying currently there are other people who are floating in the middle of the water. And what we need, Right Honourable Speaker, we need immediate intervention to save the lives of those people who are in the water. If you are to wait, Right Honourable Speaker, as we directed, until next week or another day, I think those people may perish in the water. Let us look for immediate intervention to rescue those people, Right Honourable Speaker.
The honourable members, last time we had the issue of the floating islands. I believe the Prime Minister's office arranged to go and rescue those people. So can I direct the office of the Prime Minister, especially the Minister for Disaster Preparedness, to arrange and rescue the people who are floating in the middle of the sea, where their engines have been confiscated, and give us an update by Wednesday next week. Honourable Ojara.
Yes, thank you, Right Honourable Speaker. Right Honourable Speaker, let me start with the obvious. To thank the security forces for restoring hope and confidence and security and peace in northern Uganda. However, Madam Speaker, there is some element of the security forces that have started again to destabilize the peace that has been brought in by the security forces. On the 27th, Madam Speaker, of June, 8 armed forces went to the district of Lamour and then went and disrupted a council meeting that was organized under the instruction of the Minister of Health and the guidance also of the Ministry of Local Government. The same thing happened again on the 10th of July, whereby 15 security forces went again when the council meeting reconvened and disrupted the council proceeding. This, Madam Speaker, has caused a lot of anxiety, a lot of problems with the people of Lamour, and therefore the people of Lamour has requested that the minister in charge of internal affairs should come and elaborate and explain to this House why this persistent disruption of the council meeting is taking place in Lamour. And then a thorough investigation should be done to those who are
But Honorable, what are the reasons for, does the soldier just go to a council meeting? Is it a district council meeting? Is it what? From Kitgum? Okay, Honorable.
Thank you, Madam Speaker. And I thank the colleague for giving way. Madam Speaker, Kitgum, we border Lamour. And this House, we have representatives, including a minister from Lamour district. We actually interact with most of the people there. What my brother is presenting to this House, Madam Speaker, there is a political war over the location of the constituency, which they want to use the district council to turn it around. And I would want to pray, Madam Speaker, that since we have even representatives, honorable members of parliament, the woman and the minister, they should be in position to give us a clear information. But the fact is that there's political wrangles in Lamour where the local councils want to sit outside the arrangements to make decisions against what has been brought in this House to create constituencies.
Members, I think I will invite the members of...
Madam Speaker, just 1 minute.
Yes.
Just because I gave her the floor to give me information, and she has given me the information. I just want to summarize now. Madam Speaker.
Maybe, can we get from the member of parliament? She's from Lamour, she's the member for Lamour.
Thank you, Madam Speaker. Madam Speaker, I am here to inform the House of the exact situation in Lamour. Madam Speaker, right now we have the issue of the constituency on the ground. That is true. But Madam Speaker, the correction I would like to make is that the people of Lamour requested for a district, for a constituency, for two constituencies, and that is what was submitted. 2 counties that were submitted, but the Minister of Local Government said the population of Lamour cannot be given 2 counties because of our population, and were given 1 county. Madam Speaker, I do not think the people of Lamu are against the county that is being given to them. Madam Speaker, what happened in Lamu the other week, as a member of parliament, I heard it by rumors. I do not have unofficial communication about any attack from the army against the council of Lamu. 2, another misinformation is that the council of Lamu is not against the creation of another county. So I want the House to record this right. Lamu is interested in another county, but the issue here is when they requested for 2 counties and they were given 1, the council of Lamu wanted to be given the opportunity to do the demarcation of which sub-counties go where. And that was why they wanted to meet as a council. But the RDC and the security organs blocked, to my knowledge, blocked the council meeting before it took place, before they were even seated in the council hall. But I do not have any information about the army going to disrupt a meeting that had not even started yet. Thank you, Madam Speaker.
Honourable members, that's a local issue. It should not even be here as a matter of national importance. Sort it out first there. Honourable Bika Songa. Oh, Minister from Lamu. Okay, Honourable.
Thank you very much, Right Honourable Speaker. What is happening, Right Honourable Speaker, is that the council meeting in our districts, the border districts, are supposed to take place when the Ministry of Health and the Ministry of Local Government have cleared and given them SOPs. Now, when these are not there, because we are a border district, with COVID there at the border, I don't accept the order. You are a liar. You are fighting us. The point is,
Honourable members, respect one another, please. Allow the member of the local area to speak first. Yes.
The point is, he is not from Lamu. He is not from Lamu district. What are you after in Lamu district? You don't come from Lamu district. I'm talking with authority. I've represented for 4 terms. I represented that constituency. I know what is good for my people and what is not good. Now the clarification here is the RDC has not received a clearance from these authorities in order to hold council meeting. So the police were asked to preserve the laws of COVID laws, not to allow this meeting to take place. That is what is on the ground. And if the Minister for Health and Minister for Local Government gave us the authority, they will have the council meeting. There's nothing wrong with it. Thank you.
Okay, Honourable members, that's a local issue. Let us leave it there. Let them sort out from there. Honourable Bika Songa.
Thank you, Right Honourable Speaker. I rise on a matter of urgent importance concerning the plight of the refugees that the government of Uganda allowed to enter Zombo district, but they are now living in fear of relocation to unknown destination. Uganda is a state party to the 1951 Refugee Convention and its 1967 protocol, as well as the 1969 OAU Convention governing the specific aspects of refugees. The universal human rights that are most relevant to the refugees are well known to Uganda. UNHCR, on the other hand, promotes 3 durable solutions: voluntary repatriation,
local integration and resettlement. Uganda went ahead to develop the Refugee Act of 2006, where Uganda asylum policies allow aliens who have lawfully entered Uganda to move freely in the country and to live where he may choose with the rights, including freedom of movement and expression. Now, these refugees that have entered, they are now currently at the DFI. For your information, Right Honorable Speaker, you came for my Thanksgiving. They are just on that land in Alur Kingdom. They are fearing that they are going to be relocated. And therefore, the prayers are as follows. One, His Excellency the President of Uganda to prevail on OPM and UNHCR and other humanitarian agencies to allow the refugees to remain where they are now in Alur Kingdom. The Prime Minister should come and clarify to this Parliament so that the refugees who thought they found safe haven do not continue to live in distress in fear of getting relocated outside the kingdom. UNHCR and other humanitarian agencies to come to the rescue in Zombo district and Alur Kingdom to help these refugees. Rich countries to match Uganda generosity by increasing funding. Finally, should this position be the position of OPM and UNHCR and other humanitarian agencies to cause this kind of forced migration outside Zombo district and Alur Kingdom? The host population prefer to keep the refugees whom they share as the same tradition, culture, and identity. I beg to submit.
Now, I don't know, can the refugees demand where to, on their own to say for us, want to be in the city of Kampala, don't touch us?
The clarification I want to add is that in the 1960s and up to from 1960 to 1965, there were many Congolese refugees that entered Uganda, and they were relocated to Acholi P in Agago district, the current Agago district. And most of them lost identity. But this time the local population have decided, instead of living with these refugees in their homes, they have decided to offer land where these people can remain with the same people and identity so that they lose the...
Honorable Bika, you are telling me that a refugee can come and say, for me, I want to sit here in Kampala. This is a responsibility of the government.
That is why I've put it as a prayer to the government.
I think what you should do is to inform the government that there's a huge number of refugees that have come into Zombo. Can you address the situation? But to say for us want them, they should live near us, we dance like them.
Right Honorable Speaker, Honorable Hilarone can confirm because he's the one who received on behalf of government and he even directed the place to have permanent infrastructure. Thank you very much.
But even that is wrong. Honour members, I went to Zombo. We have a wonderful district farming street, brand new. It has never been used. And now we are being told that the refugees, for them, they can stay in our DFI, a new one. No. Sorry, but...
Right Honourable Speaker. It is true, Right Honourable Speaker, because of COVID, government had resolved that no refugees or no foreigners were allowed into our country. And these refugees we are talking about are about 3,016 people who are camped at the border, and they were there for months. And out of courtesy, our president actually became sympathetic with those people who are camped at the border, and gave me clear, strict instruction that we just simply get those camped at the border inland, screen them, and then accommodate them. But we close the border. We should not allow more refugees to come in. So what I did, Right Honourable Speaker, we went there with the UNHCR, United Nations High Commission for Refugees, and other officials, including the MP who just presented the case. The Alur Kingdom definitely gave some land in a place called Tiak. It's 17 kilometers from the border. They wanted these people hosted there. But the place is not prepared because to host a refugee, refugee people in one location, you need to have water systems in place. You need to have clinics in place because they fall sick. You need to have all the facilities that requires hosting of refugees. So they are currently kept at the DFI, which you, Right Honorable Speaker, you saw, to be screened. And the UNHCR currently is run out of money because the donors have not given them the money that they need to improve on that attack location they gave us. So temporarily now, the UNHCR has gone to Zombo to meet the king and explain to the king that we have spaces in Arua, we have spaces in Rhino Camp, we have spaces in those places where the facilities are there. So for now, let's shift the refugees there until such a time when we have enough money to prepare this place you gave us, then we remove them, take them back. We can bring them to the place. So there's no conflict there, and I don't think Parliament should be brought into this. This is a small matter. Thank you, Your Excellency.
Honourable members, but I want to remind the Minister of Agriculture, when I came back from Zombo, I informed the House about that facility which we are not using, which is new. I even put in writing. I think we should not just waste money. Our children should be studying there. Yes. So now, honourable members, the other issues are really the one of the hailstorms. Please, Honourable Ngiro, write to the Minister of Disaster Preparedness. Honourable Franca, your issue is coming because 2 other members have asked the question of honoraria for councillors. So we shall not take it as a matter of national importance. Let's go to item 3. Item 3.
Item number 3, presentation of petition of members of Matongo Lost Land Recovery Families Organization.
Where is that?
Thank you, Madam Speaker, for your indulgence. Madam Speaker, again, I rise here on a procedural matter. Madam Speaker, on the 26th of last month, the High Court of Uganda asked the Attorney General to produce one Simon Peter Odong, whose rights has been violated. To date, he has not been produced, Madam Speaker. Last week, the Attorney General promised that he will come back. Yesterday, he didn't give a response. Today, Tuesday, this weekend, Madam Speaker, the wife managed to access him, but he found Mr. Odong in a very terrible situation in Bombo Barracks, in Bombo Hospital. So, Madam Speaker, I don't want to labor so much. Can we know why the Attorney General has defied the court ruling? But also, the family wants to know, what is this crime Simon Peter Odong has committed that he cannot be allowed free access to the family, to his lawyers, and they want to know what crime he has committed to undergo such humiliating abuse on his body. Madam Speaker.
I don't know where Dr. Attorney General is here.
Thank you very much, Right Honourable Speaker. I do appreciate my senior colleague's concerns. Actually, yesterday I had a chat with him about it. I want to bring it to the attention of this House that as the Attorney General's chambers, we got in touch with the IGP to find the location of this person, and we gave the order that the court order should be followed and he should be released immediately. As of yesterday, I remember talking to Honorable Cooper about the same. I just needed some clarification because my senior colleague, the Attorney General, had been in court, so we had not discussed it. He simply sent me a text message. I got more information from Okupa and got in touch with the IGP, and I can assure the House that Odong will be released.
Now, I don't know why they were addressing the IGP. I thought the man is under the hands of the army. I thought he was in Mbuyao. I don't think...
Madam Speaker, I can give information. The people were directed to produce Simon Peter Odong in 48 hours. The Attorney General, and of course the other one was the Chief of
Military Intelligence, and the Inspector General of Police. I gave the Attorney General the documents, including the medical documents from the police hospital in Naguru. That was on the 26th when we were given 48 hours to produce. Today is about 20 days since that time. And the Attorney General did receive these orders on the 29th of June, and he signed here, and it was received by your office. So all the information has been furnished. I even gave another copy here to your senior colleague 5 days afterwards. Honorable Ruth Nankabira, if you saw what this boy is going through, what the family is going through is so. If we want to give information, the one Simon Peter Dong is in the Bombo barracks, in custody there. I even gave the contacts of the wife, the sister, to the Attorney General and the Minister of Defense. So, Madam Speaker, maybe the other thing, Madam Speaker, which I will plead with you, if the Attorney General is taking 20 days to respect the order, why don't I will plead with you, if it pleases you, Madam Speaker, and the committee and Parliament, that the Committee of Human Rights of Parliament and the Committee of Defense and Internal Affairs visit Bombo and we see what is really happening, Madam Speaker.
Okay, I will give my ruling when I've established exactly where he is. Either in the hospital or in the barracks, I don't know, but I'll give my ruling on that. Okay. Honorable, let's go to item 3. What is Honorable Gafabu? Honorable Chen.
Madam Speaker, I will seek for your indulgence to allow me raise a very urgent matter that cannot be skipped because of its importance. Madam Speaker, I'm raising a matter concerning the plight of Ugandan soldiers serving in the African Union mission in Somalia. Madam Speaker, over the last 1 month, there have been increased cases of attacks on the Ugandan soldiers serving the African Union in Somalia. And yet there is hardly any information on the same from the government of Uganda. Madam Speaker, currently there are 2 contingents of Ugandan troops in Somalia, the battle group BG-27 and 28. The tour of the duty of BG-27 expired in April, while that of 28 expires on 31st of July 2020. However, both BGs were granted 4 months extension. Madam Speaker, however, this extension has implications on A, eligibility of soldiers to benefit in case of any eventualities of war. Say the disability and death has already occurred in case of the 5 UPDF soldiers that lost their lives on Sunday 12th. On Sunday 12th, July 2020, and 1 whose body was dismembered on Tuesday 14th July, that was yesterday. UPDF only recovered 1 leg of the Ugandan soldier in Somalia.
But, Honour Member, I don't know whether those details are really palatable to be put on the Hansard. Just talk about the principle. I think you're going to injure the families.
Okay, Madam Speaker,
the families.
Allow me to say the prayers, Madam Speaker. Unattended uncertainty of entitlement of the soldiers receiving the emoluments of the period of the extension. It is something that needs to be clarified. In addition, Honorable Speaker, I am aware that Uganda has been involved in various peace support operations in various parts of the continent in the recent past, notably South Sudan, Democratic Republic of Congo, and Central African Republic. However, this House has not been availed with information on the status implications of this international engagement. Madam Speaker, I pray there should be a need for regular briefing of Parliament on the situation obtaining in Somalia. 2, there is need for comprehensive progress update of Parliament on Ugandan engagement in the peace support operations overseas to aid Parliament do the evaluation of efficacy of these overseas engagements. 3, the Ministry of Foreign Affairs should formally update the House on Ugandan's foreign policy in respective states that are hosting Ugandan troops in peace support operation. Madam Speaker, these are matters that require urgent attention for the situation to run normally in the country. I thank you.
And okay, honourable members, we have noted the concerns of the honourable member. The Minister of Defence should be able to brief us about the prayers. Item 3. Item 3.
Item number 3.
Thank you, Madam Speaker. Thank you very much for allowing me to raise this point of procedure. Madam Speaker, the matter I wanted to raise on this floor, which I have ever raised, has become so difficult for especially the people of Agago, the councillors, because I have raised it not once, not twice, and I wrote, following your guidance when I came over to your office, I wrote to the ministry about the same, because all the councillor 3 of Agago district have been receiving less pay for the honoraria. They were supposed to be paid 35,000 shillings per month. But this money, they are paying 19,000 shillings, and they wait until it is accumulated for a whole year so that it can attract tax. So these two matters the councillors want to understand. I wrote to the ministry, but we are up to now, we haven't received any replies, and the councillors have become impatient because for the last 4 years, really, Madam Speaker, even if it were members of Parliament, it's not really fair for someone to miss their entitlement for 4 years. And we are now in the final years of our term, Madam Speaker. The councillors want to know their fate. So I would like to pray that the Minister of Local Government comes clear on this matter, on this floor of Parliament, to clear the air on the measures to ensure that these councillors get their payments in arrears, including the taxes that they were not supposed to have paid. Thank you, Madam Speaker.
Honourable members, I think it's important that the government responds to the concerns of the members who are presenting those who cannot come here. Minister of Local Government, this matter has come many times on the floor of this House. We are giving you until Tuesday to come and give a response to that issue. Item 3. Honourable Muhumuza? Not here. Okay, let's go to item. Anyone to represent Honourable Muhumuza? Okay, item 4.
Item 4, motion for resolution under Section 8.3 of the Parliamentary Elections Act 2005 for review of representation under Article 78(1)(b) and C of the Constitution.
Minister?
Right Honourable Speaker, in the August House, this is a motion for a resolution under Section 8, subsection 3 of the Parliamentary Elections Act 2005 for the review of the representation under Article 78, Clause 1, B and C of the Constitution. Whereas during the constitutional making process, the people of Uganda emphasized that one of the main principles that should govern the composition and functioning of Parliament is participatory democracy and inclusiveness, and whereas the legislature should be composed mainly of representatives directly elected by the people, due regard should be made to representation of special interest groups that had been marginalized by society. Whereas Article 78, Clause 1 of the Constitution provides that 1A, members directly beg your pardon?
No, please don't listen to the hecklers. Proceed with your motion.
Whereas Article 78, 78 Clause 1 of the Constitution provides that Parliament shall consist of A, members directly elected to represent constituencies, B, one woman representative for every district, C, such number of representatives of the army, youth, workers, persons with disabilities, and other groups as Parliament may determine. And whereas Parliament in 1996 determined by Section 37 of the Parliamentary Elections Interim Provisions Statute of 1996 that the representatives of the special interest groups would be as follows: the UPDF, 10 representatives, youth, 5 representatives, workers, 3 representatives, and persons with disability, 5 representatives. Whereas subsequently, Parliament by Section 11 of the Parliamentary Elections Act 2001 made provision for district women representatives and for the representation of the UPDF, youth, workers, and persons with disabilities as follows: A, 1 woman representative for every district, B, 10 representatives of the UPDF, C, 5 representatives of youth, at least one of whom shall be a woman, D, 5 representatives of workers, E, 5 representatives of persons with disabilities, at least one of whom shall be a woman. And whereas Section 8 of the Parliamentary Elections Act 2005 provides for the following representation in respect of Article 78, Clause 1B and C of the Constitution: 1. District or city woman representative, 1 woman representative in Parliament for every district or city. Special interest groups, that's number 2. A, 10 representatives of the UPDF, at least 2 of whom shall be women. B, 5 representatives of workers, at least 1 of whom shall be a woman. C, 5 representatives of youth, at least 1 of whom shall be a woman. D, 5 representatives of persons with disabilities, at least 1 of whom shall be a woman. And whereas Article 32, Clause 1 of the Constitution, affirmative action is about affirmative action in favor of marginalized groups, it provides as follows: notwithstanding anything in this Constitution, the state shall take affirmative action in favor of groups marginalized on the basis of gender, age, disability, or any other reason created by history, tradition, or custom for purposes of redressing imbalances in which exist against them. Whereas in the past, women, youths, workers, and persons with disabilities were denied participation in the government of Uganda through customs and practices that marginalized their status in society and could not participate on an equal footing with others, and yet they have special interests that need articulation and representation. And whereas their inclusion in the composition of Parliament is a guarantee by the Constitution of minimum participation of these groups in the democratic processes of government, and their representation is one form of affirmative action which the state is required to take under Article 32 of the Constitution in favor of groups marginalized on the basis of gender, age, disability, or any other reason created by history, tradition, or custom. Whereas the representation of the army has been part of the historical process for the army to appreciate how the problems of Uganda are resolved by civil leaders with the underlying objective of evolving a culture of commitment to the rule of law and constitutionalism, a culture in which the army is subordinate to the mandate of the people given to civilian authority in accordance with the Constitution. Whereas Article 78, Clause 2 of the Constitution provides that, 2. Upon the expiration of a period of 10 years after the commencement of the Constitution and thereafter, every 5 years, Parliament shall review representation of paragraphs B and C of Clause 1 of this article for purposes of retaining, increasing, or abolishing any such representation and any other matter incidental thereto. Whereas the period of 10 years after the commencement of the Constitution expired on the first day of October 2005, and Parliament in December 2005 reviewed the representation under Article 78, Clause 1, B and C in accordance with Article 78(2), and resolved to retain the representation, and subsequently reviewed the representation again in October 2010 and October 2015, and resolved to retain the representation. And whereas Parliament is required under Article 78, Clause 2, to review the representation every 5 years after the first review, and whereas the review is now due since the representation was last reviewed by Parliament in October 2015, and whereas it is imperative that the review is done by Parliament in light of the forthcoming general elections of 2021, now, therefore, be it resolved by Parliament as follows. Resolution. That in accordance with Section 8, subsection 3 of the Parliamentary Elections Act 2005, and in accordance with Article 78, Clause 2 of the Constitution, the representation of Parliament under Article 78, Clause 1B and C is reviewed as follows. District and city women representatives, one woman representative for every district or city. Special interest groups, 10 representatives of the UPDF, at least 2 of whom shall be women. B, 5 representatives of workers, at least 1 of whom shall be a woman. C, 5 representatives of youth, at least 1 of whom shall be a woman. And D, 5 representatives of persons with disabilities, at least 1 of whom shall be a woman. And for purposes of representation, at least for purposes of representation in Parliament. Moved by Kafuzi Jackson Kargaba, the Deputy Attorney General.
Is it seconded? Motion is seconded. Order on who? Yes. Justification. Justification.
Right Honorable Speaker, our history tells us that we've had cultures and customs that have been detrimental to some interest groups. Some interest groups have not been able to move at the same pace as the others. The women have, in particular, been selfishly gagged and left behind. Tradition has confined them to the kitchen. And since this government came into power, it embarked on an empowerment scheme, an empowerment move. And in so doing, we embedded an article on affirmative action, particularly to deal with these wrongs of history in order to correct them and create equality for everyone and create a clear and flat ground for us all to operate. For that reason, the special interest groups herein named should be considered and granted leave to operate. Thank you.
Right Honorable Speaker, I want to appreciate the presentation, but otherwise, the Minister is emphasizing the spirit of parity, gender parity, and to ensure that the disadvantaged are not left behind. However, Right Honorable Speaker, the spirit which the Minister has shared with us is not in this document. Because on page 5, item 2, the 10 representatives from Uganda People's Defense Forces, 5 representatives from workers, you are talking of either 2 women or at least 1 woman or at least, Right Honorable Speaker, Uganda is a signatory to the AU Charter, which has already adopted 50% representation on gender basis. And Right Honorable Speaker, this Parliament is on record as having agreed to 30%, but in the case of Parliament, 40% of women representation. The spirit of what has already been resolved and is being practiced is not in this document. So, Right Honorable Speaker, I disagree with the presentation. This document does not take into account the dynamism, how much things have changed over the years. The women have developed over the years. The women cannot just be considered as at least 1 when they are 10. Why at least 1? You are already discriminating the women. So I think that is completely wrong, Right Honorable Speaker. The spirit of gender parity, the spirit of taking care of the disadvantaged situation in our society has not been captured in this document. So, Right Honorable Speaker, I'm asking the Minister to clarify to me first why he has brought this document in that kind of spirit.
No, honour members, I think if you are convinced about something, make your proposals. Just make your proposals. Don't say, now you clarify to me and then agree. Wait, at the right time.
Can I propose that in all the presentation must be 50%? That is what the AU Charter has mandated us to do, and Uganda has signed that.
Honour members, let's be orderly. Please, let us be orderly. Let us be orderly. We had not even started the debate, please. Wait. Honour members, just hold on. Now, Attorney General, yesterday I indicated to you that the issue of the elderly is not a review. The issue of the elderly is amending the composition under 78(1)(c). It is amending the composition of section of Parliament. Yes. So correct that language, not review. amending the composition of Parliament first, then the review takes place on the existing.
Should I come over or what? Right Honorable, we have two motions.
I've seen it. I've read your second motion.
Yes.
You are saying that in accordance with the Article 78.2, the representation of Parliament and Article 78.1 is hereby reviewed.
Yes.
By including 5. It's not a review.
Oh.
I told you that you should amend 78 to create a new category. You're amending the composition first, separately, then the review will be done on the existing. That is not a review.
Are you suggesting we...
I want you to amend your resolution.
Madam Speaker, on that very...
Wait, you know.
Yes. To include the elder. That is a
Honourable members, you have had the motion and the justification. I'll call you, yes. The only thing we don't have a number is Brigadier Rev Kwaso, you had something to say. Yeah, thank you, Right Honourable Speaker. I don't know whether the Deputy Attorney General just made a mistake, but from what I know from the last Parliament, the review originally were 2 members of Parliament, 2 women out of the 10 members of Parliament, and the review said that it should be a third, and that's when we were made 3 females out of the 10. So I'm wondering why they are going backwards to a position that had been, yes, instead of actually increasing, they are decreasing. So I beg that clarification, Right Honourable Speaker, and I even raised it yesterday, Right Honourable Speaker. I thank you.
Further procedure. Madam Speaker, I think the Attorney General must be clear on this. He has dodged a number of articles of the Constitution. Now, when you read the motion, Article 78(1)(c) gives the categories. 78(2) does not allow Parliament to add in any new category. The only process we can have to bring any change here is by bringing a bill under Article 259. Anything against that, you'll be taking us to Constitutional Appeal number 1 of 2002, where Kawanga Samogeni took Parliament to court, and Madam Speaker, where the judges talked about carryable legislation. So anything you do now, by bringing in any new category, you have to amend the Constitution, not a motion. So I pray that Mr. Attorney General, since you are the legal advisor of government and you are the Attorney General, kindly go and address yourself to this matter. Anything outside that is against Supreme Court ruling. Thank you, Madam Speaker.
But honourable members, we have jumped the gun. We have not yet gone to that motion. I was only telling them that they should need to correct their resolution.
Okay,
but we are now dealing with the review.
Well, unfortunately, Madam Speaker, the motions seem to have been consolidated, but going by the provisions of Article 78 of the Constitution, if you read clearly Article 78, 1C and 2, there is no way Parliament can act by way of a motion to amend Article 78 of the Constitution. So we can only go by the provisions of amendment of the Constitution and Article 259 if we are to introduce any new category.
They can stand on
Wait, Pastor?
Madam Speaker, I just would like to add proposal on what Honorable Cecilia has given. Madam Speaker, if we go mathematically, we have always talked of 1/3, and 1/5 is further to 1/3 compared to 2/5. That means then we should go at least 2 women. When we talk about the vulnerable what? The vulnerable class of people. At least 2 women. Men will protest when we say 50-50. But at least we should have 2 women. We may have all the 5 women, but we must make a deliberate effort to put 2 women, at least 2 women out of 5, because 2 is closer to 1/3 compared to 1/5. At least 1/3. So that will be 2/5. This is a principle which has to be practiced in very many structures of government. We moved out to local council, and we found also putting 1 woman out of 5 in local government accounts committee. Is it local park? So for us, we advise that it should be at least 2 women, even in local government park. And everywhere this principle must apply. 2 out of 5, at least. It can be also 5 out of 5 women. But affirmative action demands that the women should be at least 1/3. So 1/3, 2/3 is closer to 1/3 compared to with 1/3. Information taken from the whip.
Thank you very much, Right Honorable Lord. Madam Speaker, for purposes of being consistent, I thought that we should go by what is in the Constitution by mentioning the percentages. Because when it comes to a group like UPDF,
where they are 10. When you say 2 women, it will be at least 2 women out of 10. Yet if you said at least a third of every group must be women, that will augur well. It will be consistent. This is the information I wanted.
Thank you for the information. It is still the same, whether we say 30% or a third, it still amounts to the same thing. So 2/5 is the best position compared to 1/5. We must insist on that principle. We may not yet reach 50%, but at least we should fulfill the 30%. The 30% must be fulfilled in every structure of government. Women. This is what I can say, because I see the workers, at least 1 woman, and yet there are 5. Or you go to youth, at least 1 woman. Why 1 woman? It should be at least 2 women. Information taken.
Okay, honourable members, information very quickly. I want to make a ruling.
Thank you, Right Honourable Speaker. The information I want to give to the law, with due respect, so that we can share as a house, as we legislate, is that some of these affirmative action groups are voting by region. In the year 2000, we faced a problem when we were going to have youth elections, where they said 5, then determining the number of the female youth. When it was taken to region, it became very difficult to assert to a particular region that for you, in order to get the third, this region must give us a female. That is how we reached a consensus that at least 1 to be a female. However, despite so, some regions have consistently sent a female. That time I remember, my youth MP was Honorable Ruth Namayanja. When I look at the youth group now, I'm also seeing at least some regions. The next one was Honorable Anita. Then, and we have progressed. I just wanted to share that information so that as legislators, we know where we come from to reach that point. Thank you.
Thank you very much. We must make that deliberate effort. We should not be satisfied with 1 woman. Even for the youth, we can still make that deliberate effort to make them 2 instead of just 1 out of 5. But when it comes to people with disability, I just would like to say, let us keep the principle of 30%. It's better than 30% or 50%. At least we are moving towards 50% when we make it 2/5. Thank you.
Honourable members, this yes, Attorney General.
Right Honourable Speaker, concern has been raised by my senior colleagues on the procedure, how Article 78(1)(c) can be put into effect by this Parliament, while the article leaves the door open for Parliament to create another or any other interest group. The procedure, it has not been done before, and the procedure is not prescribed. I would want to leave it to you to guide in your ruling on whether it should be by motion or by bill. Thank you.
Okay, honourable members, I want to propose the following, that the motions both be moved and we send them to the committee. However, I have been asking myself, this is the first time we are adding a new category to the special interest groups. And I think it may require a bill. It may require a bill for an act of parliament. So Please, Honourable members, please. So let me allow the minister to move both motions. We send them to the committee. But I'm almost convinced that we actually need a bill for that particular part of adding a new category. We need a bill to amend section 78. So can you complete the moving, then we send them to the committee? But yesterday he had moved both of them.
Does that provision say you amend by a motion?
I think yesterday you had moved both of them.
What we need to know,
But
do you think Parliament can enable Parliament
now we get the one again. Let's say one would not
that if there is need for an introduction,
you could deal with orders that
must be done through an amendment. But Parliament is one
nawe tebabitegeera bibaddaku tebabitegeera bibaddaku tebabitegeera bibaddaku tebabitegeera bibaddaku tebabitegeera bibaddaku tebabitegeera